This is a case I'm reviewing. Back in 2021, my patient had a corneal transplant. You can see that she's had a transplant because all these little sutures there. And the reason that she had the transplant is because she had a pterygium removed. A pterygium is caused by sun damage, and it literally is a piece of skin that grows onto the cornea and starts to impede the vision. So too much sun exposure can do that. It's important to wear sunglasses midday sun. So after they did the pterygium surgery, they had put a medication in there to kind of keep it thin to prevent her from having another pterygium. But what ended up happening, it was too thin and it caused an infection, and the infection damaged her cornea to the point where they had to go in and do a corneal transplant. Once she recovered from the transplant surgery, she was doing well for a couple of years, but then her transplant started rejecting. So in 2024, so 3 years later, we had her wearing a scleral lens and she could no longer tolerate it because her cornea just kept on getting too thick. You can see how cloudy it is here. The sutures have been removed, but you can see that it's just a haziness. And the cornea is much thicker. Before it was about that size, now it's like 700 microns. And what's also happening is she's getting these cysts in the cornea because the cornea is not able to tolerate having a closed system. So what we ended up doing is we put her into a lens that has these channels as well as fenestrations to allow the tears to actually flow in here and allow more oxygen to get to the eye. And then this is how it looks now with the channels. You can see that there's no longer any bullae or cysts that are in the cornea, but you can see clouding of the tear layer because we have that constant tear exchange that's occurring, but we need to do that in order to give her enough oxygen to the eye. But fortunately, at 45 years old, we can get her to 20/40, and that is, sometimes that's as good as we can get. Without the lens, she's legally blind in that eye.